Today, on a Lunch and Learn, I want to talk about alternatives to cortisone and pain pills for pain relief. Because cortisone and pain pills are usually the main thing that are prescribed by Western medicine when you have any joint injuries and ligament injuries and pain. So let's talk about alternatives. So we're gonna talk about traditional pain relief methods and then alternatives like Prolozone therapy and Shockwave therapy. We'll compare alternatives to the cortisone surgery, and then we'll conclude. My name is Martina Erskine, and I'm a nurse practitioner at Joe Wellness Partners. And I'm one of the injectors, one of the people that also do pain and injury department treatment, which are all the regenerative medicine treatments here. So what are the traditional pain relief methods for joint, ligament, and muscle pain? So number one are cortisone injection. Cortisone injections are something they usually offer when you come in, you're very swollen, you have a lot of pain, and they give you a shot. However, you cannot do more than 3 shots a year. And I will talk about it why, what are the side effects of getting cortisone shots. And another option than usually offer, it's a pain pills or muscle relaxants. And of course, if none of those methods works, they very often suggest surgery to repair some ligaments if there's full thickness there. So what is cortisone injections? It's a corticosteroid injection. It mimics effect of cortisol, which is hormone that we naturally produce in adrenal gland. It's called stress hormone because it's produced in our body when we are stressed. It helps us lower inflammation, helps us produce a lot of glucose, which is energy molecule. So we can run away from the stress, we can run away from a danger. However, cortisone, it's catabolic hormone. Catabolic means break down tissue in your body. So there's always a price of producing a lot of glucose. However, that glucose production, everything can nicely help elevate the pain and decrease the swelling. So that's how cortisone shots work magically, on like reducing the inflammation, reducing pain. What are the downsides? First one, this is just temporary solution. Cortisone only works for 3 months, up to 3 months, lowering the inflammation, helping with pain, and after that wears off, and you're still left with the injured tissue. Also, because it's catabolic hormone, breaks down tissue, it over time weakens your tissue. So if you inject cortisone right into injury, actually make your ligament tendon injury way worse and makes it more prone to tearing. Moreover, because osteoporosis makes holes in your bones, so weakens your bones, destroy your cartilage too. So if you inject cortisone in a joint and you do it very, very often, over time degrades your cartilage. And also can flare up out-of-control diabetes because, like I said, cortisone increases glucose in the body to help you run away from stress and injury and gives you this extra superpower for a short period of time. But if you're not doing physical activity, that glucose stays high in your blood and they can lead to diabetes. And also, I always say that diabetic people are the sweet people because when you have a lot of glucose in your blood, bacteria loves it. And that's why people with diabetes are way more prone to infection like UTI, which is a urinary tract infection, or any type of like a bacterial infection. Just bacteria loves sugar. So having high levels of sugar in your blood, it's never a good thing. So a lot of cortisone shots can increase chances of getting infections. And what are the pain pills? So pain pills are analgesic. They're oral medication that can reduce and relieve your pain. There are some of them like over-the-counter pain pills like acetaminophen, Tylenol, NSAIDs like ibuprofen, and also muscle relaxants. There are also prescription pain medication like all the opioids like morphine, oxycodone, and all of that. So what are the downside to pain pills? Of course, just give us temporary relief of pain, so it doesn't actually help you treat and heal your injuries. Moreover, ibuprofen can lead to GI issue like GL ulcers and also can destroy your kidneys if you take too much and cause leaky gut. Tylenol, however, it's very toxic to your liver, so can cause liver damage if you do it too often. Opioids, of course, leads to addiction. We get addicted to opioids, tolerance, dependence. And if you take too much morphine, too much opioids, you can basically shut down your respiration. So your body stops breathing. So the overdose can kill you. And muscle relaxants cause a lot of drowsiness and dizziness. So you not necessarily can take them and drive to work or go to work. You can feel a little bit off and dizzy and weak. So what are the alternatives to cortisone injection and pain pills? Regenerative medicine has all of them. So number one, let's talk about prolozone therapy. What is prolozone? It's actually prolotherapy plus ozone. So it's like a mix of two words. And first I'll explain you what's prolotherapy. So prolotherapy has been used for many, many years. It basically involves injecting some kind of irritant or stimulator into your tissue to stimulate the healing cascade. Usually it's a dextrose. Dextrose is like sugar molecule, more complicated sugar molecule. When you inject it into ligament, tendon, joint, it promotes the growth of a new healthy tissue. How? It causes a little bit like a microtrauma, mild inflammation response that then can increase blood flow, and then that's how it stimulates body's natural healing mechanisms. Like that leads to repair and strengthening of damaged tissue. And what is ozone? Ozone is a gas therapy that is used in so many different areas in a medicine. Ozone, it's an oxygen, but instead of two molecules of oxygen, you end up having three molecules of oxygen. So it looks like a triangle. So it's extremely, extremely reactive. So wherever you inject ozone or put it on tissue or something, it causes huge reaction, which is a good thing, because that's how it stimulates tissue to do something, to stop like being lazy and doing nothing. So it's used in a lot of different departments in medicine. The mechanism of action increases also oxygenation because it's an oxygen donor. So really brings more oxygen to the tissue, increases circulation, and it's very, very anti-inflammatory. So nicely can help with healing. Like you see, prolotherapy causes mild inflammation, while ozone is very anti-inflammatory. So they nicely combine into like a perfect treatment. So let's talk more about what's in Prolozone exactly. So when you have that Prolozone solution, what are we injecting into your ligaments, tears, joints? So of course we have a carrier solution like saline. Saline is just there for the dilution, for the safety, and to add some hydration and volume expansion. So when you have, for example, nerve entrapment, we can do hydrodissection, which is separation of that sticky tissue on the nerve. So we nicely separate the tissue out from the nerve, and that helps the nerve run freely. So that's what saline mostly does, is the carrier solution. Anesthetics, they're optional. We don't always use them unless patient ask for it, which is lidocaine. And that's something that will help with pain management, will help you reduce your anxiety if you're really scared about shots. It will keep the area of injection numb for up to an hour. So it can help you, feel just much better, because injection definitely leaves some kind of soreness and discomfort. Bicarb, it's bicarbonate. It's a solution we add because it's very, very alkalytic. So we want to make that injections more alkalytic, because ozone is very, very acidic, the same lidocaine. So to kind of counterbalance that acidity of the solution, we add bicarb to buffer the pH of the solution. And also it can help stabilize the ozone. So ozone, it's more stable for longer period of time if it's with bicarb, and then promotes that release of oxygen from the ozone when it's already in the tissue. Those three ingredients are mostly the ones that are the healing, that are do the magic. So number one is the dextrose. Like I mentioned before, it was always used in prolotherapy, dextrose, as an irritant because it induces very mild inflammation, which stimulates the body's natural healing processes that increase the blood flow, and it can recruit growth factors, immune cells, and fibroblasts. So that's why prolotherapy, it's been used for many years. It's been very, very successful. Now this is like prolotherapy on steroids, but without steroids. Vitamins, vitamin B12, that's what we put in our solution, because vitamin B12, it's so good for nerve regeneration. A lot of people that have low B12 very often have like needles and tingling and a lot of nerve issue and cognition issues, because B12, it's necessary for nerve conduction. And also B12 can increase the red blood cells formation, more red blood cells, more oxygen to the tissue, and just it's like an energy vitamin. And lastly, ozone, that's like the most powerful ingredient. Ozone is very antimicrobial, so kills all the viruses, protozoa, bacteria, recruits stem cells to the area, cause angiogenesis, which is formation of new blood vessels, has a lot of growth factors, cause vasodilation, so there's more blood flow to the tissue. It's extremely anti-inflammatory, boosts your collagen synthesis, boosts your oxygenation because it has that oxygen donor, and can nicely modulate your immune system. So now we'll talk into details, like all the benefits of Prolozone. And I have 12 points, so I'll try to not get too much into details with all of them. But I just want to explain you how powerful Prolozone ozone is for our tissue. So like I said, antimicrobial, very powerful antimicrobial agent, basically breaks down that wall of bacteria and make the bacterial cell content like spill out. So it can kill all the bad bacteria that are like around our wound or tissues and injuries, so it can prevent infection. It's very often used as for wound healing to help you kill all the bacteria so the wound can heal better. Also increases circulation, especially that microcirculation, because helps our red blood cells change form. So then the red blood cells can go into deeper and more tiny capillaries. And because of that, oxygen is delivered to those tiny little capillaries, tiny little cells better. So it's really good for our eyes, every part of the body that have very small capillaries. So increases this blood flow to the tiniest area of the body. Causes vasodilation. It can stimulate production of nitric oxide, and nitric oxide it's natural vasodilator, and more dilation, which means like relaxation of those vessels you have, then more blood flow. So vasodilation is always a good thing. You always want that, especially for erectile dysfunction. More blood flow, the better the erection. More blood flow to your injuries and joints, the better they heal, because more oxygen and nutrients goes in. Also, Prolozone stimulates growth factors, especially VEGF, which is vascular endothelial growth factor, and TGF beta, which is transforming growth factor beta, and then promote angiogenesis, which is formation of new blood vessels. So wherever you inject ozone, Prolozone, you end up producing more blood vessels in that part of the body. Okay, what else? Collagen synthesis. That's pretty cool because ozone can stimulate fibroblasts, and fibroblasts produce collagen. So more ozone you inject, more fibroblasts comes to the part of the joint wherever we inject it and start making collagen. And collagen is so important for cartilage, skin, and a tissue healing, because those are good fibers that nicely help us fill in any tissue tears. Oxygen release, like I said, ozone, it's a donor for oxygen, so helps to bring that oxygen molecules to all the cells that need it the most, and can enhance tissue oxygenation. It's very, very anti-inflammatory, decreases the pro-inflammatory cytokines and increases the anti-inflammatory cytokines. So it's really nicely modulating immune system in inflammation. That's why it's so anti-inflammatory. So it's almost like a cortisone shot. When you do ozone injection first, you feel a little bit burning because ozone, like I said, it's very acidic. And minutes after, you feel such a pain relief. People say like they're pain-free for some time after getting ozone injection. So it's just like cortisone, but doesn't damage your tissue. And also it can increase glutathione, which is very powerful antioxidant, and superoxide dismutase, SOD, that is also a very powerful antioxidant. And they go and grab and neutralize all the reactive oxygen species, which is those small little things that will just go and like react with other tissue and destroy them. So they nicely catch it up. And of course, modulate immune system, so increases the phagocytosis process. And phagocytosis, it's basically like Pac-Man. Tell your white blood cells, hey guys, come over, turn into Pac-Mans and start eating all the debris, all the bad things that are all around the wound or around the tissue tears, and helps them regenerate. Because healthy tissue cannot regenerate when there's so many dead zombie tissue around them. And lastly, last 4 points, it's an actual muscle relaxant. So if you inject ozone, it helps your nerve receptors that are involved in muscle construction, helps them relax. So there's not so much a message going from your nerve to your muscle to stimulate constriction of your muscle. So nicely relaxes your muscle, which can help with pain also. It stimulates our mitochondria. Mitochondria are those little engines. In every single cell, we have an engine that runs that cell. And mitochondria are very important because they produce ATP, and ATP is very essential for cellular repair and regeneration. ATP is like a gas, Every single car needs gas to drive. That's what ATP does. You give the cells more gas so you can drive and ride for longer. And also stimulates stem cells. So when you inject prolozone in any damaged tissue, it recruits the stem cells, make them, oh, come over here, and also the progenitor cells. And they come to the tissue and start healing it. And lastly, ozone help with cell migration because make you produce more fibroblasts and endothelial cells, and it's very, very crucial for any wound healing and tissue repair. So in summary, on a cellular level, prolozone helps cellular differentiation, so make the cells differentiate into different cells, change into the cells they needed the most, and cell proliferation, which is basically cell reproduction, makes you produce more cells to fill up that tear, fill up that injury. Angiogenesis would make you produce more blood vessels, more blood flow, help regulate inflammatory processes. So it's very anti-inflammatory and help you remodel your collagen, produce more collagen. So that's on the tissue level. And on a human level, something that we can notice is it can reconstruct damage or weaken tissue, can reduce our pain, can decrease inflammation and swelling, and it can improve our tissue just strength and function in general. So what is it mostly used for? Prolozone, it's used for pain relief, reduction of inflammation. People after doing prolozone, they just have improved mobility, stronger and more flexible, healthier muscles, and also accelerate healing. So start that healing cascade and speed it up. So other application, ozone or prolozone is also used in dermatology to treat any skin condition like burns and infection. You can actually put ozone gas in like little oil carrier, put it on your face, and can help to heal and kill all the bad bacteria because it's very antimicrobial. So it can help with very bad cystic acne or any type of bacterial or viral skin conditions. It's also used for wound healing. They put some healing solution or like just water, normal saline. They infuse it with ozone and put on a wound so it's antimicrobial and speeds up the healing cascade. So it's really good to use for burn wounds specifically, any type of ulcers that cannot heal. And it's also used in dental applications to heal an infection, dental infection, and speeds up their healing. So what is shockwave therapy? That's another option we offer here at Joy Wellness, that it's alternatives to traditional treatment. We use START's radial shockwave therapy. So shockwave therapy, it's very non-invasive, doesn't require any injections. You don't have any punctures. It's painless. It's basically acoustic energy, which is like a sound energy called shockwave that is generated outside of your body. And then it's transmitted to your body via kinetic energy. So you put it wherever you have tears, pain, swelling, and you shockwave it, and it brings more blood flow and help your tissue to heal. So what are the conditions that are successfully addressed with shockwave therapy on the whole world, not just here at Joy Wellness, but like really a lot of people implement shockwave therapy those days. And it's really, really good for any tendon disorders, for any myofascial pain, for frozen shoulder to kind of break it up, that adhesion molecules. It's used for carpal tunnel syndrome to calm down that very, very stressed and enlarged nerve and bring more blood flow to that nerve that is suffocating. It's used in plantar fasciitis, very successful. There's a lot of articles talking how good it's for plantar fasciitis, which is that pain you have from your heel to your toes. You just nicely go there and relieve that pain. It's really nice. It's used for scars to soften the scars, all type of scars, especially post tummy tucks. We have a lot of patients that comes to kind of loosen up those scars. They're very big and nasty, and you just want them to heal better. Shockwave is perfect for that. Also for stress fractures, it can nicely bring more blood flow to fractures, more tiny fractures, help them heal. It's also used for back pain to release all that pain and tension on the back, neck, everywhere. Fibromyalgia, osteoarthritis too. It's also used for nerve entrapment and also any type of ligament injuries. So how shockwave works? Number one, shockwave is just like ozone, increases blood flow and causes angiogenesis, formation of new blood vessels. So first you have that vasodilation. You have this nitric oxide goes up and substance P and calcitonin gene-related peptide. They all go up and prostaglandin, and that leads to widening of your blood vessel, which is vasodilation, more widening, more nutrients, vitamins, oxygen goes in. So that happens. And then that increases blood flow because the wider the vessels, more blood flow, more nutrients, oxygen is delivered, more repair and more regeneration. And then also increases microcirculation, which is those tiny, the smallest vessels. That leads to formation of new vessels, angiogenesis, and all of that. And after that, your whole endothelial cells in your vessels are just improving, so the tone it's better. So not just like temporary vasodilation, but also increase the tone and flexibility of your vessels, which can help with the blood flow for many, many years. So once the angiogenesis, formation of new blood vessels, like you see on the pictures here, you have a shockwave hitting those vessels. The vessels start like getting thicker, more flexible, more collagen, just better. So better blood flow. And how shockwave works on the tissue healing. So actually first also stimulates that vascular endothelial growth factors that makes you grow more vessels and other growth factors that cause angiogenesis, tissue proliferation, subproliferation, which is formation of new cells, and tissue regeneration. And then it enhances the whole cellular activity. So it can stimulate collagen synthesis, so also can increase your collagen production. This is all very, very similar mechanism of action of shockwave to ozone. I would say ozone is a little bit stronger because it's injectable. It's extremely reactive gas. Shockwave, it's nice, like a lighter version of it, and painless and needle-free version of ozone. So the same tissue remodeling happens, just start cleaning up this like debris, which is this old cells. It lowers the inflammation because it can promote the release of anti-inflammatory cytokines like interleukin 10 and can actually inhibit the production pro-inflammatory cytokines, just like ozone. That leads to pain relief and lower inflammation, and that also causes tissue proliferation and remodeling and tissue healing. And also shockwave can reduce your calcification. So when you have like tears in your ligaments or joints or muscles, your body's trying to heal it but doesn't really have the tools to do it, and very often through calcium on it to kind of try to push it out. Unfortunately, calcium calcifies and become kind of like a bony thing that can really irritate the muscle or ligament or other tissue over time. So shockwave actually can help to break down very soft calcification, a soft tissue, not like bone spur, but like calcification. So are the benefits almost the same as ozone? Of course, pain relief, reduces of inflammation, increased blood flow to the area, and accelerated healing with minimal downtime and lower risk of complication. There's basically no complication with shockwave. The only thing is you can sometimes feel discomfort during shockwave. You just have to tell your medical assistant, to decrease the strength of the shock waves because it's not supposed to be painful. You're supposed to feel it and feel some kind of discomfort, but not pain. So how many treatments of shockwave do you need? Usually people need around 4 to 10. You will always want to do series. It depends how bad it's your tear. So it's good to start with ultrasound exam first. If it's some gentle, mild, partial thickness tear, you probably will be happy with 4 treatments. However, if it's like a bigger tear and you want to keep bringing more and more blood flow and speed up that healing, then probably you need around even 10. And how long is each session? It's usually 10 to 15 minutes per area. So area counts as like joint or like, legs, stuff like that, lower leg, upper leg. So let's compare alternatives to cortisone and surgery. So cortisone injections, like I said, very limited benefits, only last max to 3 months, has a lot of side effects. It can degrade your joints, can cause tissue weakening, cartilage damage, and a huge potential for infection because of high glucose and weight gain too. And also cortisone injection do not address underlying issues because you still don't know what's going on. It's not going to heal you, it's just going to relieve the pain. The same as surgery. Surgery is extremely invasive. There's a lot of risk associated with surgery. You can have post-surgery infection, bleeding, a very long recovery time. The surgeries are not always very successful. They leave you with a lot of scars that can also lead to another new pain issues because scarring, it's never good. It's always suffocating for the nerves. So you can end up having way more pain after surgery. And also also does not address underlying factors, so it doesn't heal you. Prolozone therapy, amazing, non-invasive, natural, with very, very minimal side effects. The only, side effects is still a puncture, still a needle, definitely discomfort. But promote tissue healing, can reduce inflammation, and can reduce the pain, and actually addresses underlying factors contributing to tissue damage. So it can heal your tissue rather than just put the band-aid on your symptoms. The same as with shockwave therapy. It's non-invasive, it's easy outpatient procedure with very, very minimal side effects. I can provide long-lasting pain relief, promote tissue healing and regeneration, and there is no downtime. So in summary, alternatives to traditional cortisone injections and pain pills and surgery are basically much, much fewer side effects compared to injection, pain pills, and surgery, and then also way more curative results. So actually cures you, actually heals you, it can treat the injuries and can at least speed up your own healing capacities, because we all have a capacity to heal. Our body sometimes just need that extra boost, that extra message to tell the tissue like, hey, start differentiate, start building up those tissue and regenerate. So we all have capacity to regenerate. So in conclusion, always explore different alternatives treatment. Never go with like what one doctor said. Research, there's so much on the market. There's a lot of peptides, there's a lot of proteins you can eat to help with your healing. There are vitamins and minerals that can speed up your healing cascades. So there's so much to offer rather than just pain pills. So always research your alternatives, explore. And then definitely Shockwave and Prolozone are very promising for tissue healing recovery. They address your underlying factors and reduce reliance on these traditional approaches. I know this is all outside of the insurance world, but that's when the magic happens. Perfect. And then, so what's the special of the month? So we have discounted Shockwave treatment package in both Utah Clinic and San Diego Clinic. So Shockwave for treatment, it's for $450. So you have to come like twice a week or once a week to get that injury shockwave, bring more blood flow, stimulate tissue healing. That instead of 600 for 450. And also we offer Prolozone injections, so you can come over and get the injection ultrasound guided right in a joint, right in a ligament and a tissue tear. You can have free of the treatment done for $900 rather than $1,100. So that's a discount for this month, and we call it a regenerative month to come over to J Wellness and regenerate yourself. Thank you so much for listening and have a wonderful day.